Okay, what about salt and obesity? Salt pre-op as a problem in Americans and salt post-op after the MGB. It turns out that in America we eat too much salt, and we should all avoid salt and eat less salt. But right after your surgery, I'm going to tell you that everything you know about salt is now wrong. And how can we explain that? Well, first, let me explain that obesity is not just a cosmetic problem. Obesity is a complex mix of a variety of hormonal abnormalities. Obesity is a complex mix of a variety of hormonal abnormalities. So there's too much estrogen in women. And that's associated with an increased risk of breast cancer, an increased risk of endometrial cancer, an increased risk of blood clots going to the heart and death. There's an increased level of cortisol, which raises blood pressure. There's an increase in aldosterone. There's an increase in a variety of inflammatory mediators. And these abnormalities all lead to inappropriate excess retention of salt and water in an obese person. That's why you can see the swollen ankles. That's why you have shortness of breath. There's extra fluid in your lungs. That increased fluid in the skull leads to an increased frequency of headaches. Increased fluids in the head lead to increased sinus problems and allergies. Increased fluids in the joints cause increased pain and joint pain and osteoarthritis. And so obesity saddles the person with extra salt and water. They're puffed up, they're ballooned up, they're swollen with excess, inappropriate amounts of salt and water. Immediately, within minutes after the new connection is made with the mini-gastric bypass, those hormonal abnormalities begin to change. Within minutes prior to the weight loss, within minutes after the surgery, within hours after the surgery, those hormonal abnormalities begin to change after the MGB. And just as if you had taken a tablet of a diuretic, you begin to have a massive loss of fluid. Just as if you'd taken a fluid pill, a Lasix, a furosemide tablet, and you start to pee like crazy, the night after surgery, people begin to lose water because the hormonal abnormalities of obesity begin to change. And the surgery is such powerful therapy that it actually overdoes it. It actually causes so much loss of salt water that you can become dehydrated. And so our patients must take actually extra salt and water to keep up. If you don't, you'll pass out. I got a phone call this morning from one of my patients, a nurse, who was on the floor working in my hospital who passed out. And she was in the ER asking what happened. And I said, "You're not taking in enough salt." And she goes, "Oh, right. Well, I thought I was doing right." I said, "You're just not taking enough salt." And she said, "Yeah, they've given me 3 quarts of fluid and I feel better now." So what had happened is the surgeon was working on her so powerfully, and she's a busy nurse, and sometimes nurses are not the best patients. They're always very good patients, excuse me. And so she wasn't taking enough salt, and she passed out. The surgery is going to be so powerful in you, it's going to drop your blood pressure. It's going to drop your cholesterol. It's going to take away the sleep apnea machine that you have to wear at night. It's going to get rid of your diabetes, and it's going to be so powerful that you actually have to keep up for the first several weeks and months with extra salt and water, or you're going to pass out like my nurse did today. Is that close to answering it?
But is this a long-term thing? Is sodium going to be part of your life for the next 20 years or 10 years?
Well, I have 2 sodium stories for you to follow that up with, because that's a great question. At 6 months, a patient called me and said, "Dr. Rutledge, you're wonderful. This has changed my life. I feel better. This is great. But I do have one problem." And I said, "Okay, what's that?" She says, "They won't let me go to jazzercise." And I said, "Why?" She says, "Well, I keep passing out." So I asked her, "Are you drinking?" She says, "Yes, I drink 2 bottles of water." We changed her to Gatorade, which has water and sugar, which pulls the fluid into the body's bloodstream, and she stopped passing out and could go to jazzercise. 3 years after surgery, one of my patients called on the phone and said, "Dr. Rutledge, I just want to let you know I had a stroke." And I told her, my patients don't get strokes. She said, I know you say that, Dr. Rutledge, but I had a stroke, and I just want to let you know I had a stroke, and I want you to put that in my records and keep track of that. And I said, well, I don't think you had a stroke. She goes, Dr. Rutledge, look, I didn't call to get in an argument. I'm just telling you I had a stroke. And I said, well, tell me about it. She said, well, my mom has been sick in the hospital for 3 months. And I said, the morning of your stroke, what did you have for breakfast? She said, well, I was busy to get to the hospital. I didn't have breakfast. I said, okay, what'd you eat for lunch? She said, well, I was busy with Mom. I didn't eat lunch. And I said, your stroke happened at about 3 o'clock in the afternoon. She goes, yeah. And they took you were in the hospital? She said, yes. I said, they took you to the ER? Yes. They took you to CAT scan? They looked at your head? Yes. And they didn't find anything, did they? She said, well, no. How'd you know that? I said, they said it was a mild stroke. I said, do you remember the manual? She goes, oh, the manual. I said, you remember salt? She goes, oh, salt. And basically, she had just gotten dehydrated and passed out. And when you do that in a hospital, and the doctor's not knowing and her not calling me, they thought she might have had a mild stroke. So yes, forever, you have to keep up on it, not as much as the first couple of days and weeks. One of my patients works outdoors for the Department of Transportation in Las Vegas. In other words, he's outdoors in Las Vegas. You know it gets warm in Las Vegas. Yeah, so he has to work outdoors, like he busts the big lug nuts and stuff like that to take the tires off of these big road graders and stuff like that in 117 degrees, okay? Well, he has to drink Gatorade like crazy, but he does even better now than he does before, but he can't skip that Gatorade, okay? The other thing is, he used to, when he was 380 pounds, he said he could just jump on the pry bar and get those lug nuts started. Now that he's 170 pounds, he bounces on it, nothing happens. So a really good question about the salt.
And the water. Too much water.
Right, so water is something that a lot of people like to drink, and we're okay with that, but you have to be careful, because there's a funny thing. If I say you're dehydrated, hydration means water, right? Can't you fix dehydration with water? And the answer is no, because of a funny way you and I have been created. We have inside of us, in every cell in the body, a sodium-potassium ATP pump. And it pumps sodium into the bloodstream and potassium into the cells. And our blood is filled with sodium. And if we drink water, it won't resuscitate, it won't fill the bloodstream unless you give salt with it. So salt is remarkable in its ability to refill the bloodstream. And so just pure water won't. And we need that help from the salt to resuscitate, to fill our patients back up, to make them feel well, and have them stop passing out at jazzercise.
So whenever Gatorade is not available, you can just mix some salt with water.
Well, I wouldn't do salt with water. You could just drink the ocean. But what we do is you keep, the little salt packets from McDonald's?
Uh-huh.
You tear that open and have a lick.
With lemon. That would be good.
Yeah, there you go.
That's true.
No tequila.
After, not before. Now, those of you who don't have the surgery, this is not for you. Yes, sir.